Hello, everybody. Welcome to NUR 113 and your lecture recording for Individual Module 2, Health, Wellness, and Illness with a specific focus on immunizations. Here are your learning outcomes, same as in your syllabus and in your book. And just a quick little picture here. This is pretty typical, right? You can see this kid's face looking at this person giving him this injection, and he is not too happy about it. We're going to watch a quick little video from the American Academy of Pediatrics and the Truth About Childhood Immunizations. So let's listen to that.
Vaccinations.
Because, when I'm getting my kids vaccinated, I think, okay. So we all want to do what's right by our kids, of course, and while for some moms that means getting their little ones vaccinated right away, others delay or even avoid immunizations altogether. So what's the right choice here? We didn't know, which is why as part of our ongoing My Parenting series, we've asked Dr. Ari Brown to join us this morning. Not only is she a spokesperson for the American Academy of Pediatrics, but she's also the author of the books Baby 411 and Toddler 411. Dr. Brown, good morning. Thanks for being here.
Thanks for having me.
I want to start off with safety because I know a lot of moms worry about mercury and other ingredients in vaccines. Should they be concerned?
No, and let's start with mercury. So there was a preservative that was used in vaccines prior to 2001 that contained a special type of mercury that was never ever known to cause any adverse health effects, but it was removed from the routine childhood vaccinations in 2001. So we can check that box off and
check that one off.
Quit worrying about that one.
All right.
And then the other ingredients parents do need to know about. We do have ingredients in vaccines that actually prevent contamination of the vaccines or increase the effectiveness of the vaccine. And those ingredients are found in very trace amounts, and actually our daily environmental exposures are greater than what's in those vaccines. You should also know that the World Health Organization and several other medical organizations have looked at these ingredients and have found them to be very safe. So the bottom line is you don't need to worry about all of these things.
But I want to ask you about this because when I'm getting my kids vaccinated, I think, okay, I'm getting them immunized against something a disease that's essentially disappeared here in the United States. So why still vaccinate?
Right, and that's a great question. And the greatest irony of vaccine success is that parents today are unfamiliar with the diseases, and that's because vaccines have done their job. But what you need to realize is that when less than 90% of people in a community are not vaccinated, that leaves them susceptible to outbreaks. Outbreaks can happen, and we've seen that all over the United States, but particularly in California. You can just look at 2008, there was a measles outbreak that caused hospitalizations, and in 2010, there was a whooping cough outbreak, and actually babies died. So these diseases are very real, and I can tell you as a pediatrician, I've taken care of children who have suffered from these diseases, and I've taken care of children who have died. These are real diseases and not diseases you want your kids to have.
So when is the right time then to start vaccinating your child?
Well, the important thing to know is that you want to do it as soon as it's safe and effective to do so. So, for instance, the hepatitis B shot can be given to newborns shortly after birth, and then other shots we start doing at 2 months. And the key to remember is that our youngest children are the most vulnerable to these diseases, and that's why we want to protect them as soon as possible.
So I know that some parents choose to kind of space out the shots, right? They don't want to do everything all at once. Good, bad?
Bad.
Bad.
Bad. And the reason why is that parents seem to think that the risk of vaccines is greater than the risk of the disease. And that's because they're really unaware of the risk of infectious diseases. You can't prevent infectious diseases. You can't control when they're going to show up and be around your child. The best you can do is to protect your child so that if they are exposed, they have that barrier of protection. And so I do recommend that you follow the recommended vaccination series through the American Academy of Pediatrics and the Centers for Disease Control, because that way your children are protected when they should be. A lot of parents are concerned there are too many shots too soon, they want to wait, and just in our lifetimes, when I was a kid I didn't get nearly as many shots, and there's so many more now, but the answer is that's good news, because these are serious diseases. In fact, there are 3 different types of bacterial meningitis that we protect against now, and so I'll say to parents, well, which of those do you not want to protect your child from?
No, absolutely. You're a parent. You can't help but be a little bit nervous about it. Well, some parents out there are still nervous. And so what would we say to these parents? What would you say to me?
The answer is talk to your pediatrician. And truthfully, most of us are parents. And so as a pediatrician and as a parent myself, I vaccinated my own kids to protect them. And I wouldn't do anything differently for yours.
Well, that is sound advice. And thank you so much for coming by, Ari, and sharing this information with us this morning.
Thanks for having me.
Good to see you, Doctor. And if you're looking for more information and insights about immunizations, check out healthychildren.org, the official parenting website of the American Academy of Pediatrics.
Okay, so a little bit of an old school video by the American Academy of Pediatrics, but it comes along with some really good points. Back in the early 2000s, there was this big push to say that vaccines caused autism, and celebrities got behind it, and they perpetrated this huge story of which they believed to be true. But since we have found out that the physician who was running that trial study and doing all of that research actually fabricated his results and his data. He has actually since lost his medical license. So we created this huge scare in the country about vaccines and what it's doing to our children, and it was completely untrue. So it's very important when we talk about health promotion and wellness to educate our parents and educate our clients that vaccines are a wonderful thing because they've eradicated many diseases for which we no longer even see, and that is solely because of vaccines. So let's move on. What is a vaccine and why should clients get one? Well, we know that a vaccine is something that we give to someone in order to prevent them from getting some type of illness. We give them some antigens, and antigens will produce antibodies, and those antibodies will subsequently recognize the disease and protect our body against it. We cannot prevent all infections or infectious diseases with vaccines, but we can provide acquired immunity for some specific diseases with vaccines. So what is active immunity? Let's take you back to 112 real quick. Active immunity results when exposure to a disease organism triggers the immune system to produce antibodies to that disease. Exposure to the disease organism can occur through infection, so someone can actually get sick from contracting the disease, or we can introduce the disease organism through vaccination, and we can do that with a weakened virus or a killed one. Either way, if an immune person comes in contact with that illness or disease in the future, their body will actually recognize it and start to immediately produce those antibodies to fight it off and keep them well. The key with active immunity is that it's long lasting, and most of the time it's lifelong. There are certain vaccines for which you need boosters for, to continue to provide you with immunity from a certain illness or disease, like tetanus would be a good example of one of those. But active immunity actually happens when your body has to produce those antibodies to that disease. Passive immunity. This is provided when a person is actually given the antibodies to the disease rather than producing them with their own immune system. So, for example, a mom who breastfeeds is passing on her antibodies through breast milk to her newborn baby. That's a form of passive immunity. Same thing when a baby is in utero. The antibodies actually will move through the placenta to the baby and gives that baby passive immunity from illnesses and diseases. We can also provide passive immunity to people whenever we give them blood products that contain antibodies such as immunoglobulin. And those will help with sort of an immediate protection against a specific disease. And that's only given to somebody when it's needed. So the major advantage of passive immunity as opposed to active immunity is that whenever someone receives a passive immunity to a disease, the protection against that disease is immediate. It works right then. But active immunity takes some time, sometimes several weeks to develop, right? Because your body has to work. We give somebody an antigen through a vaccine, or because they've gotten sick and their body starts to produce antibodies to help protect them. But that takes time. Your body has to recognize it. It's got to produce the antibodies. It's got to produce them in an effective amount. So that takes time. Passive immunity only lasts for a few weeks or months, though. So that is the downside for passive immunity. Active immunity is long lasting, and passive immunity only lasts for a little while. We have all kinds of different types of vaccinations. We have live virus vaccines, killed virus vaccines, and we have toxoids. So live virus vaccines are prepared from living viruses or bacteria, and they have been weakened down in a lab setting, and these live vaccines will replicate in a vaccinated individual and produce an immune response, but it's usually so weakened that it causes very mild symptoms or no symptoms or disease at all. So an example here might be like the flu vaccine. The flu mist is a live virus, right? We've weakened it down, and it might cause you to have a little cold after you get it, but it will not cause you to have the full-blown flu. Killed virus vaccines are created in laboratory settings by actually inactivating whatever the pathogen is. Usually they use some type of heat or chemical to kill that virus or bacteria, and that destroys the ability for it to be able to reproduce itself. But it keeps that pathogen intact so that the immune system can still recognize it and realize that it's not supposed to be there. Hey, we've got an intruder, and it will send out its soldiers or antibodies to attack it and recognize it for the next time around. So a toxoid is made by inactivating the toxin that causes disease symptoms. So as with organisms or viruses used in killed or inactivated vaccines, this works in much of the same way. I'm sorry, that sentence is missing there. What you need to remember about these is that they just work in the same way, but we just inactivate the toxin that causes the disease symptoms. So think about tetanus. That's a toxoid. One thing to remember here whenever we're talking about types of vaccines is that live virus vaccines are contraindicated for pregnant women. Some of your live vaccines include measles, mumps, and rubella, so your MMR, HPV vaccine, the human papillomavirus vaccine, and varicella, which is what treats chickenpox. Pregnant women cannot receive live vaccines, and that is because they are passing on a passive immunity to a newborn baby whose immunological system has not developed to the point it's safe for that individual or that newborn or fetus to be exposed to something that's a live virus. So here's a copy of a current vaccine schedule. You can always find this schedule at the CDC website and the American Academy of Pediatrics website. But I want you to focus mainly on birth through 18 months because those are when children tend to get the majority of their initial vaccinations. You heard them talk in the video about hepatitis B. Hepatitis B is given at birth, almost directly after a baby is born, within those first few hours of life. And then we give a second dose around 2 months, and then a third dose around 6 months. But you can see that there's a range there from birth to, and for the first dose, and the second dose 1 month to 2 months, and then the third dose can be given anywhere from 6 months to 18 months. Most people stick to that birth, 2 months, and 6 months schedule. So I want you to just look over this schedule and sort of know where children get which vaccines. And another one to note on here is varicella, the one that treats chickenpox. They didn't have a vaccine for chickenpox whenever I was growing up. I actually had them whenever I was in kindergarten. But now they have a vaccine, and you rarely ever see chickenpox anymore. But they usually get the first dose of varicella at 12 months. And if you think about what we just talked about, the different types of vaccines, it might make sense to you why varicella is not given until 12 months, the first dose. You can see the second dose is given between 4 and 6 years. But what happens during that first year of life for a baby? But they develop, right? They developmentally go through changes. Their immunological system grows and matures. So we don't want to be giving a live vaccine to a brand new baby. So it should make sense to you why that's sort of pushed up to a year. And if you also notice, we said measles, mumps, and rubella was a live vaccine as well. And you can also see that children don't get that until 12 months either. This is just a continuation of this chart, vaccine schedule for adults. So take a quick look over that. And let's move on. You notice the little sentence down here at the bottom, and it just says not getting a full course of the vaccine leaves a person unprotected and still at risk for getting a disease. So kind of the same concept as whenever we talk to patients about antibiotics. You want to take that full course so that your body gets everything it needs to kill off whatever is going on with you. And it's the same concept for vaccines. Everybody needs to get the full schedule. So if it is the hepatitis B vaccine, your babies need to get all 3 of those shots so that they're fully protected against that disease. Are immunizations safe? Yes, they are very safe, like we heard in the video, but like any medicine, they can cause reactions, and normally they're mild. If they're a live vaccine, they may cause a little sign or symptoms in young children, and sometimes in adults. They can cause a little bit of a fever, and that's just your body recognizing there's something there that's not supposed to be there and telling it to send out some antibodies. And then, of course, you can always get site reactions where the vaccine was given at, like a sore arm. If any of you guys have ever had the Tdap vaccine, I'm sure that you have. That one really makes your arm sore. It's terrible. But very serious reactions are rare. We also need to be cognizant of what people are allergic to, because as you know, if you're allergic to things like eggs, you can't get the flu vaccine. Now, what would happen if we stopped vaccines? Well, if we ended up stopping vaccinations, then we would see a reemergence of all of these diseases that are so foreign to us now. We still see every once in a while a measles outbreak. Whooping cough has become very big. So pertussis is the same thing as whooping cough, and that has become another thing that we have seen outbreak. And what happens is when you let's focus on whooping cough, for example. Adults are vaccinated for whooping cough early in life, so as they're children, but as they start to grow up, they may lose a little bit of that immunity. So here's one of those vaccines that you need a booster for. And as you know, you have a newborn baby who only has passive immunity from its mother, and this is not one of those vaccines that they get right up front. And so if they're exposed to pertussis or whooping cough, they can actually end up contracting it. And this is sort of how we've seen an outbreak of that. We also see outbreaks of things with our immigrant population. And so that's a population to focus on whenever we are focused on health promotion. And why are childhood vaccines so important? Well, the answer is really clear, because it's always better to prevent someone from getting sick as opposed to treating that person after they become sick. Here's another little table that comes from your book, and these are vaccine preventable diseases and the vaccines that prevent them. So here you see listed chickenpox, diphtheria, Haemophilus influenza type B, that's connected with your Hib vaccine, hepatitis A, hepatitis B, flu, and measles. I always sort of cringe when I see flu listed here because, as you all know, the flu comes in innumerable strains, and the CDC does its very best to kind of hone in and hone down what strains they believe that they're going to see for the next year coming in, and then make that vaccine to treat those specific strains. But as you know, we are not perfect, and we are also not fortune tellers. So we cannot determine with 100% accuracy what strains of the flu are going to emerge. And more I've seen in my career that people used to, if you got vaccinated from the flu, you hardly ever saw anybody get the flu if they were vaccinated. But more and more as time moves on, I see people get vaccinated and then still end up with it. So I kind of, twitch a little when I see flu listed here. This is just a continuation of that chart, and these diseases listed here are mumps, pertussis, polio, pneumococcal vaccine, rotavirus, rubella, and tetanus. Rotavirus is a big one that kids get. It causes diarrhea, fever, and vomiting, and it can be very, very serious for small kids, especially babies. And you will see it run rampant at daycares if children are not vaccinated. So this is a big one for children. So let's talk about nursing interventions in relation to vaccinations. Well, some of your responsibilities are to provide accurate information about the safety of vaccines. We don't want to perpetuate the idea or the ideology that vaccines are unsafe. We want to make sure that we're giving out correct information and that it's accurate. We want to discuss risks and benefits prior to giving a vaccine, and this comes along with your visor sheet, that VIS form that you give to an individual before you give them the vaccine. They're printed off from the CDC. There's one for every single vaccine that was ever invented, and those sheets are updated every so often, and it lists the risks and benefits of that particular vaccine on that sheet. And it's required that you give that sheet to someone before you vaccinate them. We want to provide parents or the patient with the most recent VIS form, exactly what I just said. And I call it a visor sheet sometimes just because that's what we called it where I worked before. You can see these two things bolded here. We want to provide the parents or the patient with an opportunity to have their questions answered before giving consent for immunization. So we want them to have the ability to read that VIS form. If they can't read, we need to read it to them. If they have questions, they need to be answered before this person gives consent before you give them the immunization. And we want to obtain written consent before vaccinating somebody. So they always must sign the consent form after they have been given ample opportunity to read the VIS form and answer questions are answered. If parents or the patient refuse the vaccine, then it's their choice to do that, and we should not make them feel bad about their choice. We only need to provide them with accurate information. But if they refuse, we need to document that. We want to teach about local reactions to the site where we give the vaccine, and you all should be familiar with this: redness, swelling, pain, soreness for a couple of days even. There might be some type of induration at the site, and we need to let them know about other types of reactions as well, which could include a fever, for children, fussiness or irritability, fatigue or a loss of appetite, and provide guidelines for managing those mild reactions at home and making sure that parents have the correct dose information for any type of drugs that we might tell them about that could manage those mild reactions, such as Tylenol or Motrin. However, it has recently been sort of studied about Tylenol and Motrin and treating a fever related to a vaccine. And it has been proven that if you give that Tylenol or that Motrin within a certain time frame, that the vaccine doesn't tend to be quite as effective. And if you really think about that, it actually kind of makes sense. Used to moms, and probably some still do, would actually give their kids some Tylenol before ever taking them to the doctor's office to get that vaccine to manage any type of fever or fussiness that might happen afterwards. But what is a fever? A fever is your body's response to something, telling your body that something's not right. Correct? We get a fever when we end up with bacteria. We get a fever whenever we start to get a virus. It is your body trying to fight off something that's not supposed to be there. So if we go in and mitigate that fever before it ever happens, then we could potentially be causing that vaccine not to work quite as well because we have suppressed our body's natural immune response against an outside invader. So just keep that in mind. All right, so a couple of questions here. The nurse is administering an immunization to a 2-month-old child. Which immunity will the child form? Okay, so we are giving a 2-month-old a vaccine. Does this kid have acquired immunity, active immunity, natural immunity, or passive immunity? And the answer here is active immunity. This occurs when the individual forms immune bodies against a certain disease, either by having that disease or by introducing that disease to them through a vaccine form. So your answer here is B, active immunity. What about question 2? The parents of a neonate ask the nurse what is the recommended age for beginning hepatitis B immunization and which response is the most accurate. This is the very first one on that vaccine schedule that you saw. And the answer here is A, at birth. We give hepatitis B at birth. Birth, 2 months and 6 months is your standard immunization schedule for hepatitis B. Newborns also get 2 other things right after they're born. They get a vitamin K shot to help clot their blood, and they get erythromycin in their eyes. And that just protects against any kind of, sorry guys, my phone's ringing. The erythromycin protects against any kind of bacteria that might have gotten in the baby's eyes during the birth process. All right, what about question 3? It would be most appropriate for which infant to begin receiving the measles vaccine? A 6-month-old, B, a 12-month-old, C, an 18-month-old, and D, a 24-month-old. And what do we know about the measles vaccine? Measles vaccine is included in which shot? The MMR, measles, mumps, and rubella. Remember that. And if you can remember what MMR is, what type of vaccine is it? It is a live vaccine. So what is your best choice here? The answer is B, a 12-month-old. And really, they can get it anytime between 12 and 15 months. This is a chart that I found that shows the change in the disease rate or cases per year for these specific diseases listed on the left-hand side. So you can look and see that pre-vaccine era, the maximum number of cases per year for something like measles was 52,866. That was in 1952. That was before they had a vaccine for measles. In 2009, there were only 2 cases in the entire year of measles. So this shows you how effective that vaccines are and have become. Look at pertussis. Remember I said pertussis was one of those that needed a booster every so often? Before the vaccine was developed in 1937, there were 13,333 cases of pertussis that year. In 2009, there were 371 cases. Now, that is because pertussis is one of those that need a booster. And if you don't get a booster, then you're susceptible to getting that. And we oftentimes see it in young children or in babies who have not had the opportunity to be vaccinated yet if their parents or the people who are around them haven't received that booster. But still, from 13,000 to 371, extremely effective. So when we talk about vaccines, so we can't leave this lecture without talking about injection sites. Okay, so what do we need to know about injection sites? Well, first of all, we've got to remember our 6 rights of drug administration. We have to be aware of your client's allergies and their past history of any adverse reactions to any types of drugs. We want to recognize the age and the developmental maturity of the person we're giving this vaccine to, because a lot of the times we're giving vaccines to children and not mostly adults. We want to prepare, we may have to restrain, and then we want to administer. We want to use an alternative form of pain management during the procedure, especially for children, if that's available at the place you work. Sometimes it is not. And we always comfort and reward a child after something painful has happened to them. So let's talk about the vastus lateralis. Where is that at? That is on the front side of your leg. This is the correct and appropriate and mandatory site for infants whenever you are giving any type of IM injection. It is mandatory for infants. It is given in the vastus lateralis. And why do you think that is the case? Well, think about where else we can give IM injections to people. The two other places we mainly give them are the deltoid and the ventrogluteal site, correct? Well, think about a newborn baby or an infant who does not walk yet and doesn't do very much with their arms. Do you think that those 2 muscles are developed well? Definitely not. The ventroglute will not develop until a kid starts to walk. And the deltoid can be used when children become bigger. But for babies, we want to always use the vastus lateralis because it's the only muscle developed enough to accept some type of medication. So we can use this in children less than 2 years. We use a 22 to a 25 gauge needle that is 1/2 to 1 inch in length, and we can use no more than 0.5 mLs in that injection site. All right, so what about the deltoid? This is used for older children. You really still don't see it used that much on toddlers, but it can be. So toddlers and older. We use the same size needle, the same length, and we can inject from 0.5 mLs to 1 mLs in the deltoid for these kids. And here you see my little bullet in red. We do not use the gluteus maximus until this muscle is fully developed, or the ventroglute, which means the child has got to be walking, because we have a danger of hitting the sciatic nerve. It's very unsafe to give it there if a kid is not walking. So remember that also whenever you're caring for a child who is older but does not walk. So you think about children that might have CP, cerebral palsy, children who are handicapped in some way and they don't walk, and they may be 9 years old, they're 10 years old, but if they don't walk, even if they're older, that ventroglute is not probably developed enough for you to be given vaccines there. So always remember that it might not be just in relation to age, but you have to remember their developmental status physically and mentally as well. All right, so here's the ventroglute site, and we use this for children who are 2 or older. That's given them a good amount of time to have walked and developed that muscle. We use the same size, 22 to 25 gauge, same length, 0.5 to 1 inch. And here we can use a 0.5 ml for this says infants, but it should not say infants. I need to change that. You can use 0.5 mLs for smaller children, and you can use 2 mLs for older children. Also, make sure that you read your ATI in relation to this particular lecture and administering medications to children. One thing that you definitely need to remember is that we always do safe dose before we give medications to children, any types of medications. And that's spelled out for you in ATI. So make sure that you refresh yourself on safe practices in giving medications specifically to children. And that is all for this lecture on Individual Module 2 on health, wellness, and illness in relation specifically to immunizations. Thank you for tuning in.